Hello, everyone. I am Dr. Michelle Horn, coming to you from Bucks County Orthopedic Specialist in our Doylestown office. I am one of the primary care sports medicine specialists at the office. Actually, I'm the only one, so there we go, at this office. And I'm here to talk to you about sports concussion. Some people might say concussion, orthopedics, how does this all correlate? So as I said, I'm a primary care sports medicine specialist. So my background is actually, I trained in family medicine, and then I did a fellowship in what we call primary care sports medicine, which is just basically non-surgical musculoskeletal care, and then also expands to medical issues in athletes and things like concussion and asthma and diabetes in athletes and all that fun stuff. So concussion is a large part of what I do here at the office. Our office is team physician for the Central Bucks School District schools. So you can see myself or Dr. Boylan or Dr. Cody or Dr. Griffith and I on the sidelines, not all of us together, but at the CB football games and wrestling matches and things like that. And we, as a sports medicine physician, I work really closely with the local athletic trainers and stuff in terms of getting the full story, getting histories on athletes that they bring into the office. So first thing I'm going to start with is what is a concussion? I know this is labeled as sports concussion, but you can actually kind of make a lot of correlations to regular concussions as well. So a concussion is a bump or blow either to the head or the body. So you do not need to get hit in the head to sustain a concussion that produces basically a chemical change in the brain that affects how it's able to function. Concussions are very, very different. Every concussion is a snowflake. Basically, every concussion has different symptoms based on the background of the person, other medical issues in the person, the type of injury, the type of hit. So it is very important in my line of work to be able to be very specialized and specific for each individual's concussion. Signs and symptoms of a concussion. Sometimes people have symptoms right away from a hit. There's standing on the sidelines. You certainly can watch a hit in football and the whole crowd goes, oh, and sometimes really hard hits always make us suspicious, and we always screen to see how the athlete's doing coming off the side or onto the sidelines, things like that. Some people have symptoms right away. Some athletes will have a hit and then feel like they're okay. Maybe that adrenaline is keeping them moving forward. And then a couple plays later, they realize they're having difficulty concentrating, or they develop a headache. And then those people are coming off the field and being evaluated. If someone like me is not on the field, certainly in our the Central Bucks area, usually there's always an athletic trainer who's very well trained in concussion management and diagnosing concussion. If there's any sort of questionable injury, or the athlete's not really acting right or not their usual selves, best thing to do is just keep them out and then have them evaluated either by someone like me or their primary care physician who can kind of monitor their symptoms moving forward. I have had cases where people have sustained injuries maybe the night before a Friday night football game and then don't start getting symptoms until a couple days later. I had one patient who didn't start getting symptoms until they were on a boat the next day, and when the boat started going quickly, all of a sudden they started getting headaches and dizziness. So it's important to kind of monitor not only after or in the situation of a game and after, but even up to a week afterward, people can start manifesting symptoms. So what are signs and symptoms of concussion? They fall into a whole bunch of different categories. So there's physical symptoms like headaches, dizziness, nausea, vomiting, sensitivity to light and noise. There are cognitive symptoms in terms of difficulty focusing or concentrating. Some people have problems sleeping, either sleeping too much or sleeping too little. or difficulty falling asleep. And then there's the other part, which usually the parents are the best at telling me in terms of mood symptoms. They can tell me if their child is more irritable than usual, or more easily angry, or the opposite, more depressed or more anxious. So all of these things, when people come into my office, I have a 22 symptom checklist, which sounds like torture for someone with a concussion, but it has to be done. Basically, I get an idea of what kind of symptoms they're having to categorize what kind of concussion they're having. And then we sort of strategize treatment from there. Usually a visit in our office is about scheduled for at least a half-hour visit. Probably can tell already I like to talk, so it's probably never a half-hour visit. It's a little bit longer. But I really like to make sure that people are very well equipped and knowledgeable about their injury and what kind of things they should and shouldn't do kind of coming out of the office. So if you sustain a concussion, someone suspects you might have a concussion, what do you do in that immediate time period before you come into the office? So some of the things are what we call cognitive rest, so resting your brain. This is not putting yourself in a dark room and doing nothing. This is limiting how much activity you're doing. That does include screen time, and trying to not do anything that makes your symptoms worse. So a lot of other things that I ask patients to do for me is to make sure that they're really monitoring, hey, if you read a book, like how long until you start getting symptoms? Can you read for 5 minutes? Can you not get through a line but without having symptoms? So those are the kind of questions that I'll ask in the office. So initially cognitive rest, so you can not try and read that book and things. We certainly do not recommend you return to any contact sport before you're cleared by someone who has medical training in concussion management. So either your physician or a concussion specialist. Most athletic trainers are definitely very good about getting doctor's notes before people return. And then really initially the management is trying to just modify activity so that you don't make your symptoms worse. Typical concussion duration can be 10 to 14 days. The younger the child, the longer the duration would be considered a normal duration, because younger brains take longer time to heal. So I'll usually tell people, I'm school-aged athletes, anywhere from like 3 to 4 weeks can be a normal duration. I have 2 rules. All my patients know I have 2 rules with concussion. 1, don't do anything that makes your symptoms worse. So if you're doing something and your symptoms are getting worse, then please stop, rest, so that your brain is able to recover. If you keep pushing and pushing, if you have that AP test that you're trying to get through or study for, pushing through symptoms will just make your symptoms last longer. My second rule, I already touched on it already, but do not put yourself in a situation where you can get another concussion. There are a various amount of effects if you sustain another concussion while your brain is still recovering from one. Something that is a lot more devastating is something called second impact syndrome, which is a condition where basically the brain is not able to sustain another hit, and it starts swelling, and that can lead to some serious brain injury. So if you're pushing through, you're playing, you haven't reported your symptoms, your concussion, and you sustain another hit, it could mean a very big change in your life and lifestyle. And then the other thing is also making sure that you're recovering completely before you're returning back to contact sports. So those are my 2 rules. Don't put yourself in a situation where you can get injured again, and don't push through symptoms. You just cannot outsmart your brain. Your brain has to heal in the amount of time that it needs to heal. So when we start talking about returning to schoolwork and physical activity, I try to be pretty progressive with the way that I treat my concussions. I think the longer kids are out from school, the longer they're out from doing any physical activity, especially my athletes, you're going to have emotional consequences. I guess this is a bad time to mention not being in school, because nobody's in school right now, but being in school, seeing your friends, seeing your peers, all those social connections, not being in school, being removed from that school environment can do a lot for a child's emotional health. So I like to keep you integrated just socially. And then I think honestly, I went to Central Bucks West here. I know how demanding the CB school district learning programs are and things like that. And I know if you miss, 2 days, you feel like you're behind. So that can be emotionally very difficult too. I can say that one of the reasons I love sports medicine is because I work with an incredible team, not only here in Bucks County orthopedic specialists, but then also with the athletic trainers and the school nurses. And we have a really good communication system. And I do think that especially this area does a really great job with concussion management and accommodations for school. I usually suggest some academic accommodations initially, just trying to get people back into school, but not really pushing activities. So we might have you stop taking tests or just do like audiobooks, or kind of based on like what things are triggering your symptoms. We try and avoid those and get you back to doing whatever you can do. And then in terms of physical activity, obviously I said no contact sports. I'm probably going to say that like 40 times during this talk, so you better remember it. But in terms of physical activity, like I said, especially all my athletes want to get back to sports, which is why I love sports medicine, because everyone wants to go back to their sport. So there is, I usually do like to have my athletes doing some level of physical activity. The goal is to not do so much activity that it triggers symptoms. But if you can be on a stationary bike for 10, 15 minutes, get your heart rate up a little bit, and that doesn't cause symptoms, I want you to do that. Because one of the other things to think about is when you return back to your sport, if you've been out 2 weeks, you've been deconditioning that time too. So keeping things stimulated, if you don't move it, you lose it, right? They say. So keeping things stimulated. And then also that just does wonders for your sleep. It helps regulate your sleep and your mood so much better too. So I definitely encourage some light physical activity. So the goal is to transition athletes back to school full time. So tolerating full cognitive activity, you're test taking, you're able to, take breaks in school if you need to, but usually my athletes who are looking towards clearance aren't requiring breaks anymore. Maybe they get a headache, but it goes away in 2 seconds, things like that. In terms of physical activity, like I said, I like to kind of keep that athlete doing something regularly. So we have a pretty good idea of what they can do physical activity wise. And short of doing contact sports. So when someone's ready to be cleared, they've done completing full days of school, no symptoms for several days, and then we've started increasing their physical activity. There's something called a return to play protocol, which all of the athletic trainers in the area will go through. It's a progressive amount of activity. So we're basically increasing your heart rate, increasing the stress, and increasing the amount of head body movement that you're doing each day, and monitoring whether or not you get symptoms. That return to play protocol has to be completed before you're cleared. Last thing I wanted to touch on is locally, a lot of the schools use a test called impact testing. Impact testing is basically a neuropsychologic testing developed by the people out at UPMC in Pittsburgh. Basically how it works is a lot of the athletes will take a baseline test, and then if you sustain an injury, you'll get that test done again, basically, and it can show where your deficiencies are compared to your baseline. Some people get upset if they don't have that baseline testing. For me, it is not mandatory. It's another tool that I have. But if people don't have that baseline testing, it's not the end of the world. But that is something that's used. It's usually administered through the schools. We don't have it here because usually we coordinate with the school or the athletic trainers to have that testing. But just as a note, if you're coming in for clearance for concussion, you have that available. That would always be helpful to bring in too. So I think probably good time for questions. So Karen H asks, how can I prevent a concussion? So people ask me all the time, kind of my wrap-up talk when I talk to people or I clear people in the office is, well, let's talk about, hopefully you don't have another concussion, but let's talk about it because this is the best time to educate people. You don't educate a person who's acutely concussed because they're not going to remember it anyway. So how can I prevent a concussion? So there's really no way to prevent concussions from happening. I have had people have concussions from yoga. I've had people who accidentally get slammed into a locker while a fight breaks out in school. We can't prevent those things. A concussion happens because the brain moves rapidly back and forth in the skull when that injury, that blow to the head or body occurs. So think of like a yolk in an egg. So there is no headband. There is no special helmet or anything right now that prevents that kind of motion. Helmets in general, absolutely recommended, but they are designed to prevent things like more catastrophic injuries like skull fractures, things like that. They are not designed to prevent concussion. Interestingly enough, the NFL is, looking into, obviously this is a big thing in the NFL, and they are looking into developing sensors to start testing, what specific positions are getting what types of hits that are creating concussion symptoms in athletes. And that might lead to specialized helmets for different player positions, which I, of course, think is interesting. But that is certainly not anything that's coming to the high school scene anytime soon. Elaine R. asks, so should phones and computers be avoided after a concussion? Excellent question. I probably get this question all the time because the parents want me to tell their kids how many video games and how much screen time they need to avoid. So I have two answers for this. In an ideal world, you'd try and avoid phones and computers as much as possible. Phones and computers require a lot of your brain's energy. And when you're acutely injured, especially those first couple of days after a concussion, sustaining a concussion, your body is in this sort of energy deprived state and it needs all the energy it can to heal. More energy that's available, the faster your brain can heal. There is a couple other components about phones and screen time and things like that. The farther out that we get, it's kind of hard to avoid phones and screen time in certain situations, especially now since everything's like virtual school and things like that. So my recommendation is usually kind of like everything else in terms of reading and physical activity, do things in short periods of time. So 10, 15 minutes, stop, take a break, see how you're feeling. And then if you feel good, you can go for another 10, 15 minutes. So you're basically breaking up everything that you do into smaller increments and taking frequent rest breaks. And then you see how you feel. If you feel at the end of the day, you were on your computer for a total of 2 hours and you have a raging headache at the end of the day, it means you did too much. So that's the kind of thing that I sort of get more specific about time spent on screens when we're in the office. Chuck B asks, how soon can I return to sports or driving after a concussion? So that's a really good point. I didn't really talk about driving. Driving's tricky. So technically with concussion, there is an implication that you probably have delayed reaction time. And if you're having cognitive issues, you really shouldn't be driving when you're suffering from a concussion. The other thing I always like to remind my patients too is that if you've been diagnosed with a concussion and you get into an accident again, one, you're putting yourself susceptible to getting another injury, which is breaking one of my rules. And then two, how that turns out legally, if you're driving and you shouldn't be driving, or, your driving is impaired from your concussion, that could create other issues for you. So it's based on how people are feeling and symptomatically, or how much activity they can do when I clear people for driving. I don't have a specific time when I clear them. It's pretty individualized. But certainly if we're talking about returning to sports, you have to be able to tolerate full days of school. You have to tolerate that full return to play protocol. So you're basically doing everything without contact sports before I clear you for sports. And like I said, added bonus if you have an impact test, because I like to review that too. But usually whatever I'm seeing in the office and hearing from an athlete and their parents is I probably can predict what their impact test would be. Lori W. asks, what are the long-term complications of second impact syndrome? So second impact syndrome, in terms of long-term complications, second impact syndrome is an acute event, meaning that a lot of times after second impact syndrome, which is once again when you're playing or you sustain another hit when your brain hasn't fully recovered from a concussion. A lot of times the consequences of this can be coma and death. So they're pretty dire consequences. And you don't have to have a major concussion initially to have and have a second one. You can have just mild concussion symptoms and sustain second impact syndrome, which is why it is so important to always report symptoms. And if there is any doubt, always see someone, for clearance or clarification. I love getting visits where people are like, I think I'm okay. I just need another double check. And we go through everything. And best case is I just get to, educate a little bit more on concussion and then clear people and send them on their way. So I like those visits. So I like all my visits actually. So. Sarah J. asks, am I susceptible to more concussions if I've already had one? So that's also a very good question. So I always tell people during my little wrap-up speech that yes, you are susceptible to another concussion. It is not because your brain has been broken or altered from this specific concussion, but more because if you're susceptible to one concussion, I think later, in research and stuff down the road, we're going to find that some people are just more susceptible to concussions, whether it's a genetic basis or something. So if you sustain one concussion, then you're probably more likely to sustain another one. There are long-term effects of multiple concussions, something called chronic traumatic encephalopathy, which is kind of like a degenerative type Alzheimer's-ish condition that has been well documented in the NFL players and boxers who have sustained multiple traumatic brain injuries. But we're still looking in research in terms of mild concussions or high school age, things like that, what kind of changes those are actually making in the brain. So I think, do we have any more questions? All right. Rhiannon D. Any types of therapy for concussion? Perfect. Rhiannon, thank you very much for asking that question. So in the case that someone has a prolonged recovery, so, and I'm talking in my school age athletes, 3 or 4 weeks after an initial, after an injury and symptoms, there's actually a lot of different therapies that we can do. One of the reasons my visits are longer and we have a lot of education and discussion is because, like I said, I'm trying to figure out what kind of symptoms patients are having to kind of categorize where do we go from here in terms of therapy. So a lot of people, especially children, will have what we call like a vestibular component or a balance component. So, sorry. I just heard myself in echo. So So in terms of having like dizziness or balance issues. So I'll send patients to specialized physical therapy called vestibular therapy. Vestibular therapy deals with everything from like balance problems in the elderly to concussion. I usually like to refer to offices that are really well equipped to handle concussion therapy. There's a lot of other testing and stuff that they can do. And then also other things that we use are, if there's a lot more emotional components, I'll use psychiatry or psychologists. If there's some learning issues or emotional components that are maybe affecting the learning, patient's learning, then I'll use neuropsychology. Sometimes people end up going to eye therapy. And speech therapy are the other ones I use for memory as well. So, all right, I think I am about done. I'm being cut off here. So I probably could talk about this all day. Thank you so much, everybody, for joining. And just a reminder, our offices will be opening up on an altered schedule next week. We will be offering telemedicine visits as well. If you're not quite comfortable coming into the office yet, we will be practicing all sorts of social distancing. Everyone will be wearing masks. So we definitely have made it a priority for everyone to feel safe. But then also, we don't want to delay your orthopedic care anymore. So take care, everyone. Stay healthy, and come and see me if you need me.